things I've loved about Body Interact is it really, you learn how to do medicine in it gives you a systematic approach with it. It's really nice because there's no cutting corners. Like, you really have to do a full history, a full physical, and that sort of leads you to the tests that you need. And so we personally have really enjoyed using Body Interact, and I think it's made us stronger future clinicians.
Yeah, I definitely think it makes it like realistic in terms of clinical practice, because when it comes to some of the cases, you have to like keep checking back on the patient, making sure that they're still responsive or still feeling well, or sometimes they tell you they feel worse. And so I think it does a good job in terms of like simulating a case and how a patient is going to respond to your treatment.
It's a very dynamic program, and that's one of the big strengths of Body Interact, and it shows you that, you know, it's one or two key actions can make the whole difference in a case. You know, worst case scenario, if you don't know what you're doing, you can go back and rerun it again. You'll get better. And I know personally I have, like, you know, spent several hours by myself just like re-practicing cases over and over again, just trying to figure out what's the exact way, what's the best way I can go about building a differential diagnosis and treating the patient.
Yeah, we definitely learned by trial and error, which I think is like good, because then you get it to practice this in a controlled environment, and then you don't have to worry about like, oh, if I'm gonna like put the patient at risk because I might have done something.
You do kind of get a little down on yourself if the patient starts deteriorating and you can't do anything about it.
Like, yeah, especially if you're like hearing the monitor beeping, like it just like your heart keeps racing, and you're like trying to figure out, okay, like what can I do to make sure that the patient is stable so we can like move on to the next step and see what else is going on.
It really does do a good job of simulating kind of the same sounds and things that you might hear when you're in the emergency room or when you're on the floor of a hospital. And I think it does an amazing job of really creating medicine virtually. I think we've probably learned just as much from the debriefing as we've learned from running the cases ourselves. And it's great because the first time you run a case, either you may be left with a couple questions, but the debrief is so thorough, and it shows you all the actions that were deemed like necessary, and then some of the actions that maybe weren't necessary, such as giving fluids or giving a blood pressure medication that you didn't need to give.
And so in terms of the debrief, I think it's really helpful because I think it does a good job in terms of simulating of what we would do in a in-person debriefing, because it's very similar to kind of how we go about it here with our course directors.
I agree, exactly.